I believe that caring human touch is essential to our self-image, our self-worth, our value as human beings, our very survival. So when one is deprived of that kind of nurturing, that kind of nourishing touch, self-esteem can be eroded, uh, isolation can increase, and depression can occur, which leads to a failure to thrive syndrome. Touch from another human being says, I care about you. You're not alone. There is somebody else here with you, regardless of the condition your body is in, regardless of the state of your mind. You're not alone. You're a human being, and someone cares. Touch is especially important, I feel, for those who are confined to healthcare institutions, who may not be receiving many visitors from the outside world, who may be touched only in daily care activities or with invasive medical procedures, and that's all the touch they get. So they're really lacking a kind of nurturing, caring, loving kind of attention that can come through touch.
Compassionate Touch started at Hillsdale Extended Care approximately 2 years ago. We incorporated it into our already existing activity program as one of the regular activities that we offered. As new residents enter our facility, we let them know about the massage therapy program. So we constantly have new people for the massage therapist to see. And residents spread the word. They start telling each other about the massage therapy, and others want to sign up. So though we'll lose clients as they move on, we'll gain clients. So we've kept a real stable group that the massage therapists are working with. There's so many benefits of Compassionate Touch. One of them includes the difference in the quality of life that it has provided for our residents. It's so wonderful to have people from the outside community come in and be a part of the programming here. Helps to make our residents feel that they're a part of the community. Many of our residents don't have friends or family in the community. They have the staff here, but not somebody coming from the outside, which is what the massage therapist is. So often residents in nursing homes don't get a lot of touch, except for in a medical way. One of the nicest things about the Compassionate Touch massage sessions is that it's not a medical procedure. It's not someone coming in to treat a particular area or particular illness or deal with an acute problem. It's more a relationship that's formed between the massage therapist and the resident.
I've been seeing one resident for a couple of years. We have great conversations with each other. It's an ongoing relationship that we have. And as I massage her legs and her arms, we converse, just like you and I would converse. She tells me what's going on in her life, and I tell her what's going on in my life. And even though she's bedridden in her mid-50s and living out her life in long-term care in one room, she's a cheerful, pleasant person. And I just think of her as a friend.
I think therapeutic massage is really beneficial. All of us benefit from touch. You can be quite isolated without touch and very lonely, and the touch, even to a person who is in a coma, there is still a response to touch, and people that maybe are not able to react or interact with you verbally respond to touch. There's the feeling that someone cares. It's a skin-to-skin contact that I feel is really important. And there's something about that touch and having a human that's caring and touching you that makes you feel good about yourself on the inside. And the difference between the routine care that the patient gets, medications or bathing or shower or changing clothes or changing their bed, that's a duty that's being done by someone just to meet their basic living skills and what they need to be clean and functional. This is above and beyond that. This is like a loving touch. It's an emotional touch. It isn't just functional. It makes the resident feel like they're cared for, like it's another human that's touching them in a loving way. Love is communicated in this touch.
Our staff has been very open and responsive to the use of the massage therapy, because we know as healthcare professionals that sometimes the medical treatment that is necessary and that we are here to provide can also be a very non-personal treatment. You're here to take care of a particular medical problem and treat that. So we're always looking at ways that we can expand and treat the person as a whole and look at more than just the medical problem. And massage therapy is a wonderful way to do that. The resident knows that the therapist is there just for them. It's a private time for them to do what they want, what they're requesting.
Do your hands hurt?
Thank the Lord they don't hurt.
Oh, that's
They
good.
itch, the skin dries up and it's kind of coarse, you know.
Can I put some lotion on that for you?
Well, it would help.
Okay.
What is that, Fry?
I don't know what kind of lotion this is. I think it's Jackie's Magic Lotion.
Oh, well, whatever it is, if it does the trick.
Will that be okay? Whoa. Yeah, this should help the dry skin a little bit.
Yeah, well, that's what it takes.
How's this feel?
Well, it feels soothing.
Good.
And underneath, too.
Okay. Working with people who are in later life stages through the medium of touch is quite different in specific ways from administering therapeutic massage to a younger, more active, healthy person. First of all, I'm working with people in their beds or in their wheelchairs. They're not required to remove any clothing. They're not required to do anything except just be where they are and receive the touch. So I and the massage therapists I train will adapt to whatever situation they find, whether the person's lying on a sofa, in a hospital bed, in a wheelchair. We'll work with them wherever they are and in whatever condition they're in. It becomes important to understand about age-related changes, changes in the skin, for instance, and changes that occur physically within the body with aging and with specific illnesses. It's important to know something about the illnesses that such people are suffering from so that there will not be any damage done through any kind of massage technique. Also, the psychosocial benefits, I think, become much more significant in working with the elderly and the ill, especially those in long-term health care.
One of the physical benefits from receiving the massage is the stimulation of circulation, which improves skin condition. Another benefit of the massage therapy is physical mobility is promoted in the resident. They spend a lot of time in bed or they're in a wheelchair, and in the therapy there is a certain amount of range of motion that's done which promotes the ease of movement and helps to prevent contractures. It isn't always a matter of doing the physical, functional part of the massage that we look at, that we see as beneficial. The resident benefits from having their wishes respected and from having another person just sit and listen to them or talk to them.
Often a massage therapist will find out something about a resident that we didn't know, or something the resident never opened up to us before. So it's been very helpful to our staff to get to know our residents more as people and work together with the massage therapist to provide them what they need.
I really like Mr. Burkhart.
Isn't he sweet?
Yeah, he was delightful.
By the way, the lotion, he really liked the lotion I was using.
Okay.
So I said I would leave some for him. So why don't you
Oh,
just
so
take
sweet.
this and
Thanks.
put his name
Okay.
on it.
Let me write it
I told him
down
I'd give
so
it
I
to the
don't-
nurse.
Great.
Yeah, his skin was really dry and itchy.
Yeah,
And
kind of flaky.
so the lotion felt soothing.
After each massage therapy session, the therapist keeps a log of what happened during the session, how long she worked with the resident, any particular response the resident gave, or anything she may have noticed about their skin, about their mood, how they felt during the massage, and that is maintained in the medical records. So everyone in our facility has access to the information that the massage therapist has written down about her session. We receive physician's approval for all of our resident activity programs. This includes the massage therapy. Residents pay for the massage therapy sessions in a number of ways. Some residents pay to receive the massage themselves. Family members pay for compassionate touch sessions. At Christmas time, I had a lot of requests to buy a series of massages for their loved ones. It's also a popular birthday gift. It's also popular to go along with the beautician, hair salon. It's a sort of a full package they can offer.
Paying for the services usually isn't a problem for residents. People that are on Medi-Cal get spending money, personal needs money, and some of them are not able to spend the money. They are not able to leave their room, or they don't have the interest, and they have money available, and that money is used for the massage therapy, which is really beneficial to them. I personally am looking forward to a time when there will be funding provided by Medicare and Medi-Cal in recognition of the importance of this aspect of treatment for the resident.
Our residents are not the only ones who have received the benefits of massage therapy from Compassionate Touch. Our staff has benefited as well. For me, I've enjoyed being able to have a massage right at my desk, so it's not a disruption in the middle of the day. I can have a mini neck and shoulder massage. It's a great stress reducer and doesn't take a lot of time away from my day.
Other ways that we've utilized Compassionate Touch in our facility, we have a program for the hospital personnel. It isn't just the nursing people, but for the entire staff. People who have done a really good job, and we want to acknowledge them. We offer a massage. We do probably 3 or 4 massages a month for employees to acknowledge their work and the value that they are to us, and to say thank you to them, and it's greatly appreciated. The first time I had the Compassionate Touch massage at work, I was a little concerned about if it was going to take up too much of my day. Where were we going to go to do this massage? Was I going to be embarrassed to have to take off my clothing and lay on a table or whatever? And my mind was put at ease very quickly by the therapist. We did the massage right at my desk. There was no painful manipulation, and I felt really good, very relaxed. It was just all around a very positive experience.
We've had the opportunity to hold several Compassionate Touch workshops here in our facility, and these are workshops that train others to go into the hospital setting and do massage with the residents. This turned out to be a real exciting project for our residents who are receiving the massage now. They became the teachers rather than just the recipient of the massage. It turned into a real self-esteem booster, an opportunity for them to share their experiences and teach the masseuse. And now each time when we hold a workshop, I have a line of residents who want to be the participant for the group.
What I try to do in training others to administer Compassionate Touch, what I hope to accomplish in the Compassionate Touch program, and what I think makes it unique, is that we are striving to relate to an individual rather than to a disease, rather than relating to the illness and trying to change something. We try to relate to the individual who is suffering from a certain disease or happens to be in a particular mental state. So we're not coming in as massage therapists and saying, I'm going to do something to your body to make you feel better. We're coming in and we're relating to the individual in whatever condition that person is in. And we're doing that through caring, loving touch and physical contact. So compassionate touch is basically not a set of techniques. It's a way of relating to people. It's a way of relating that comes from the heart through the hands. I think eventually more and more healthcare facilities, hospitals, nursing homes, retirement centers will have a massage therapist as part of the professional healthcare team. I think that will be offered right along with occupational therapy, with speech therapy, with physical therapy. So I think things are changing. More and more physicians are coming to see the benefits of touch for their patients. More and more people who specialize in geriatric care are coming to see that therapeutic massage is a good resource and a tool which can be used.
For other facilities who would like to start massage therapy programs like ours with Compassionate Touch, I suggest they first get in contact with a licensed massage therapist. Compassionate Touch has been successful because the massage therapists not only have training as licensed therapists, but they have spent time in the hospital setting and have educated themselves on this particular group of residents and their particular needs. I've seen a variety of changes with residents who are regular clients that get the massage therapy on a routine basis. It really depends on the individual's needs, and what they respond to.
Your hands are so soft.
Touch is a universal language, so touch is a great tool in communicating with those who are no longer verbal. When I first met Frances, she was really withdrawn. She was scratching herself because she was frustrated and couldn't communicate, and was able to be a little calmed through touch. And we made eye contact. I experienced her sweetness and really liked her. So over the months as I continued to see her, because of the programs here at Hillsdale, she started to really come alive. Eventually, she was able to get up into her wheelchair, have her hair done, and have makeup put on. She started to come alive. She's never been able to communicate well through words. However, I began to notice that she really liked touching things. She's a very tactile person, and I would begin to bring her pieces of material sometimes when I came to see her. One day, as I was putting the lotion on her hands, she reached over and started massaging me and putting the lotion on my hands and my arms, and just enjoying that. It's a sensual feeling, it's a pleasurable feeling, and to have that lotion and feel the skin-on-skin contact. We're communicating with each other, and there's a certain very special quality to our contact. Occasionally she will come out and answer with words.
Frances, I like your hair. I do. I like that, the way it's fixed today.
I've received a lot of positive feedback from our family members on the Compassionate Touch sessions. They like knowing that this is offered for their loved one.
When she first came here 2.5 years ago, she was at a state where I thought we were going to lose her. And it was just bringing her here because Hillsdale had the facilities to take on any emergency that might prevail within the next several days. That's how bad it was. And the doctor at the time said that she was failing at a very quick rate. So my wife and I thought we were going to lose her. So when I visited several days later and saw that she was responding to music and a little bear that someone had here, so we saw a lot of encouragement. And then several more days later, here her strength started coming back. Then they got her into a wheelchair, and then they progressed even further to getting her to walk in a walker. If you leave them alone, they're just sitting there waiting to die. Don't count any of these old people out. And they're not waiting to die. They're not waiting to die. They're just waiting for someone to come over and say hi to them. Touch their hand. She's a human being. She's alive. She breathes. And she deserves respect and some dignity.
One of the greatest rewards in working with the elderly and the ill is the experience that touch, that simple gift of touch, can make such a difference. And that both of our lives are expanded and enriched through that kind of contact. I mean, that really is, it seems miraculous to me because it's so simple a thing to offer. And yet when someone is touch deprived and isolated, and someone, by touching them, says, you know, I care, and you are still part of the human race, and we're in this together. That simple gift can make all the difference.